wanted to say that Paul Ryan's plan to end Medicare has been described by Mr. Duffy and others as a plan to reform Medicare. However, it eliminates Medicare as has been established for many years and puts in its place Ryan Care, which is a voucher program. This is sort of like abolishing the U.S. Marines and putting the U.S. gymnastics team in its place and calling it the Marines. Ryan Care is not Medicare, and it will require seniors to go out and hunt for insurance in the insurance market, which only under the health care reform bill will they have a chance to find insurance that they can afford that won't cut out their coverage for pre-existing conditions and so on. So on the one hand, Representative Duffy and Representative Ryan want to eliminate Medicare. Then they want to institute private insurance for seniors instead. And then they want to eliminate the health care reform bill, which makes it possible for people to find insurance that's at all affordable. Finally, the voucher system that Mr. Ryan has proposed would only increase in value based on the Consumer Price Index and not on the cost of medical care. As a physician, I am very interested in seeing the cost of medical care come down, and I believe some of the best things in the Health Care Reform Act deal with the issue of cutting medical waste. However, you can't have a voucher system that doesn't keep up with the cost of medical care and expect seniors to be able to afford it. Thank you.
I'd now like to ask Wynn Spencer to share a personal story.
My husband passed away recently, a year and a half ago. He had contributed to Medicare from the onset and developed diabetes 2 and congestive heart failure during these last years. And it was because of Medicare that we could keep control of it. We needed blood tests all the time. We were able to take care of those. See our doctor, could monitor the heart care, and made his last years more comfortable.
Thank you, Wynn. Floyd Hallberg, would you share a personal story?
Hi. Medicare has been a very beneficial program. My parents were beneficiaries of it. My in-laws were beneficiaries of it. As a result, they didn't put any medical cost burden on my family or my siblings. And I think that any way of reducing Medicare or changing it would certainly just be devastating to seniors and seniors to come in the future.
Thank you. Dr. Freeman, did you have anything to add?
I didn't prepare anything.
That's okay.
But I think the main thing that bothers me is the effort to repeal the health care plan that's been passed. There's so many things that are good about that health care plan. It's an effort to blunt the escalation of health care costs that have been happening in this country over the past couple of decades. And it has research projects in it to discover different ways of providing health care, which is one of the reasons it is so costly. The fee-for-service system has some problems with it. There are research efforts on malpractice issues to see what the best way is of handling malpractice. Implementation of electronic records, which are demonstrated to save lives, to reduce costs, and many other things like this. There are efforts to looking forward to keep abreast of developments in health care. Insurance for about some 47 million Americans that have no coverage at the present time. Disability, you can't get kicked out of an insurance plan, you become disabled. There's just all kinds of things that are in there. Your child up till age 26 is covered if they have no job or any work situation that covers them. There are many, many things about it. It's been demonstrated by the Government Accounting Office that it will indeed blunt the cost of health care over the next 10 years by a factor of probably around $210 billion. Then if we don't do something that cost of health care is going to continue escalating at a much more rapid rate because medicine, health care is getting much more technical all the time. So let's not kill this plan. Let's work with it. Let's try to make it better because it isn't perfect by a long shot. It has to do with the problems that we're having with Medicare, which are having, and so many other things.
Thank you, Dr.
That's
Freeman.
it.
Anybody else have anything to add? Nope, we're good. All right.